Good evening. Welcome to our University of Louisville Masters in Science Health Administration and Health Management Graduate Certificates program information session. I am Lee Bewley. I'm the program director of our MSHA program as well as our graduate certificate programs. I am currently the regent for the American College of Healthcare Executives Kentucky chapter, a member of our Health Management and System Sciences departmental faculty, and I'm a retired Army Medical Service Corps officer. During my time in the military, I served as a combat health support officer, health administrator, and then finally as a health management faculty member and consultant to the Surgeon General. Tonight, we're going to cover topics related to admission to our MSHA program or our graduate programs. I have our contact information at the conclusion of this presentation, and I'm happy to answer any questions, or I have colleagues that will take your questions about application to our program at any time. We've put together a slide set presentation that covers the key aspects of our program, and I will stand by to answer any questions now or in the future leading up to our admissions deadline in the summer, July 1st, 2026 for the fall 2026 matriculation. Okay, have our slide set up. Again, I'm Lee Bewley, Program Director, Regent for Kentucky Chapter of the American College of Healthcare Executives. And so why healthcare management and why this program in health administration? Nearly 1/5 of the economy is dedicated to healthcare and health administration. The practice of being a leader or manager in health organizations is to find a way to take the resources that we have within our system, the American economy, our health system, or our healthcare facility or organization, and use those resources to the most efficient and effective way possible. That's the work of a health administrator: planning, organizing, leading, controlling to efficiency and effectiveness. Practically speaking, the Bureau of Labor Statistics holds that the average or median healthcare manager in America earns about $118,000. And the growth rate of healthcare management roles in the United States, looking out the next 5 to 10 years, is about 29%. And so this MSHA program that we have in the practice of healthcare management, from a forward-looking perspective, what are we looking to develop in our program, and what type of skills and competencies are going to be required to succeed in health administration in the United States going forward, is that one, taking a population health management perspective, examining the community, the population, the marketplace that we serve. What are the needs of the people individually and collectively? What are the major stakeholders expect in terms of health status? What can we do to more cost effectively manage our population health in terms of the interconnectedness of health and health promoting and health seeking behaviors? How are we going to do that? Managing the resources and new emerging models of how we finance healthcare. The government, both state and federal, and to a certain extent municipal, have a great deal of financing and coordination of healthcare benefits, primarily through the Medicare and Medicaid programs, other federal programs, veterans, military, health and human services, public health programs. But the manner in which our society finances healthcare has largely been employer-based, in which most people receive their health insurance either through what they pay in to Medicare during their lifetimes, or is a part of their compensation. They receive healthcare benefits. Well, new financial models are changing the way that we finance healthcare. Instead of something that looks like a traditional fee-for-service, or even on a prospective basis, if a particular level of care or a particular medical device or service is provided. Now we're at a point where we're trying to find a way to take more known and less open-ended sources of financing to provide care in a more value-based perspective. And so our program focuses on those elements, as well as legacy and existing financing means. And the way that we conduct analysis is we leverage modern information systems and data, including artificial intelligence, access to information, and processing that information in a timely manner to better explain and predict patterns, but also needs of patients and communities and healthcare. And then the bottom line, of course, we're in the people business. We serve people, we serve communities, we work with teammates and colleagues, and the ability to apply effective leadership is absolutely critical. And so we address key competencies in leadership, team leadership, organizational citizenship behaviors within our program. What are the type of roles? I won't go through the exhaustive list, but wherever there is a health or health organization that serve people, that has a budget, teammates, a healthcare manager, healthcare leader, plan, organizes, leads, and controls those organizations to more effective and efficient outcomes. And that ranges hospitals to health systems, group practices, specialty care providers, logistics, entrepreneurs, health insurance, health technology organizations. And the type of roles, usually from a traditional organizational perspective, could be at the operational, the executive, or the C-suite level. We serve primarily students that are either early careerist or mid-careerist, or in many cases we have providers, physicians, other allied health providers, dentists that are seeking to extend their leadership and management competencies within their own organization and roles. And so all of these different roles within health administration across the full spectrum of health organizations, is well served by training, education, and development in health administration. Why Kentucky? Why Louisville? We find that our place here in Louisville, Kentucky is a great nexus of both healthcare delivery, but the development of knowledge and being able to attract input. A great deal of our faculty, our alumni, some of our preceptors for students that are in practicum experiences, and of course, the varying levels of urban, suburban, and rural healthcare in our Kentuckiana area provide a good learning laboratory for our students, but also for our faculty to conduct research. And so this combination of healthcare here provide a basis for education, also provides an opportunity for those folks that want to live and work in the greater Louisville area to practice health administration, healthcare leadership in our area, or of course, taking what they learn here out to the rest of the country and the rest of the world. Our graduates, this list is continuing to grow. I think every few months we add a few others, but we have folks that work across the country, definitely within the Louisville region. And as we're looking to grow this element, of course, we have folks that work in the military health services, Army, Navy, Air Force, the VA. We have folks in Health and Human Services, but a lot of the hospitals and health systems in the greater Kentucky, Louisville area and across the country are represented, and we're looking to grow those lists. What do we do here? We aim to build leaders. We aim to have a model within the way the program is conducted, the way that our students interact with each other, that demonstrate honor, integrity, and professionalism. But that extended point of building leaders of health organizations is that the critical element is that they can serve teams and communities competently. And so our belief in this program is that each of the courses that we have specific dedicated competencies that are both developed and then evaluated, so that by bringing what your competencies and skill sets to our program, we build upon that set and extend to a point so that upon graduation, a leader competent can go out and take on greater roles of responsibility, authority, and be able to serve patients, beneficiaries, and communities and teammates, more effectively by having built a set of competencies and extended them while they're in the program. A little bit about our program. Our program is CAHME accredited. That's the Commission on Accreditation of Healthcare Management Education. Among CAHME accredited programs, we're 46 of over 158 accredited programs, so top tier, top half. The program is housed within the School of Public Health and Information Sciences at the University of Louisville, and our school is CEF accredited. That's the Council for Education and Public Health. And so that dual CAHME and CEF accreditation provide a value quality affirmation of the public health related, but specifically the healthcare management education manifests within our program. Quick review of our curriculum. Currently, the online MSHA at the University of Louisville is 43 credit hours. We offer these credit hours in 8-week terms, And so the schedule that you see there, fall 1, fall 2, spring 1, spring 2, and summer, is that within a period of a year, an academic year, all of the courses of the University of Louisville MSHA program are offered at least once. We matriculate students in the first of the semesters in the academic year in fall 1. Students can progress on a part-time or full-time basis. The courses within our curriculum are predicated on the National Center for Healthcare Leadership model. And so each course within the curriculum contributes to specific competencies that develop a competent leader for the 21st century. I note that our 690 capstone course is the final course, either by itself or with a final set of enrollments. And the nature of our new 43 credit hour curriculum is that a student could conceivably graduate from our program in about 17 months. The School of Public Health and Information Sciences and the Graduate School of the University of Louisville have a opportunity for students to enroll in an advanced stage. And so through coordination with your academic advisor and with permission of the graduate school dean and the School of Public Health dean, a student could take as many as 3 courses per 8-week term after they've demonstrated the ability to successfully complete a normal course load. And so if you're interested in graduating from our program on an expedited basis, that would be about a 17-month period. And that's why you see that 690 course in fall 2 is that for students that would start in the fall, for instance, of 2026, and to have an initial enrollment of courses up to 12 or 13 hours, that is the standard load at the University of Louisville for full-time, that by taking courses at an advanced rate, a student could graduate in the fall of the following year. However, most students track with 2-year graduations, so that over a 2-year period, a student will have completed all of the courses in our MSHA program. But each student pathway is tailored to suit their own pace. It could be that life circumstances or professional circumstances would mandate that a student might want to take more than 2 years. In fact, the University of Louisville allows up to 5 years to complete a graduate program. And so there's flexibility. We characterize this opportunity as you can either tap on the brakes or the gas in order to complete the program in a manner that fits your life and your capacity to be able to enroll and complete classes in a successful manner. We also have 3 graduate certificate programs: the healthcare management, the healthcare financial management, and the healthcare quality and project management graduate certificates. Each of these certificates is 12 credits. Each graduate certificate consists of courses that are drawn from the MSHA program. And so if a student were interested in first completing a graduate certificate and earned A's and B's in those respective courses, and then later decided to enroll in the MSHA program within that 5-year period, the credits that a student earned in a graduate certificate would transfer directly into the MSHA. It's a question that's asked, if I complete the MSHA, do I have all 3 of the graduate certificates? No, you don't. And no, you don't need graduate certificates. If you earn a CAHME accredited Master's in Science and Health Administration, you will have all the demonstrated competencies. But the graduate certificate, the primary reasons that folks generally pursue that certificate is either one, they have some type of just-in-time development. For instance, you're a healthcare professional, might be in a new role, that they would be managing a budget or working with health insurance, and so they might want to pursue the healthcare financial management certificate, or they have a role that involves a great deal of quality and project management work, that particular certificate. The healthcare management certificate is a generalized set of courses, and it may be that a student might want to try one of the certificates, gain the development, but also have a sense of whether or not they wanted to pursue the full degree. And so we provide those graduate certificates either for just-in-time training and development, could be continuing education development. Maybe someone earned another management or administrative degree several years ago, and they want to come back for continuing education development and add a graduate certificate is somewhat of like a continuing education and development performance. But most students pursue the full Master's in Science and Health Administration. If you have any questions about this at the admissions process or prior admission, don't hesitate to ask us. We provide these options so that students have choices and it fits what they're looking for. And it could also fit, of course, what their sponsoring organization is aiming to pay for, to provide for in the way of tuition assistance or reimbursement. All right, a few program highlights, and then we'll close out if there's any questions that we have. Our program is very strongly tied with the American College of Healthcare Executives. That's a professional organization dedicated to the advancement of healthcare leaders that serve their communities and do so competently. There are each one of the states or state chapters. Some of the larger states have multiple chapters within the state. I happen to be the regent for the Kentucky chapter of the American College of Healthcare Executives. One of our faculty, Dr. Andrew McCart, is the incoming president for Kentucky chapter. And we maintain these ties with ACHE for a few reasons. One is that we want to ensure that our curriculum is always aligned with the current and forward-looking needs of the healthcare management community. Of course, we also provide opportunities for continuing education development of our faculty. We have networking opportunities that we can access for our students. There are often essay contests. There are scholarships that are derived from ACHE. And then there's also the opportunity for advancement to be board certified as a healthcare executive through ACHE. So we maintain those ties. Our program often participates in case study and graduate essay competitions. ACHE has an annual national case or a national essay contest. Rachel Peril, one of our recent grads, won the national competition for essay a few years ago. And just recently, we had a team that were semifinalists at the Penn State case study competition. There are multiple case study competitions each year. The deal that we have with the students is that if a student group participates in a case study competition that involves and represents the program that involves travel or registration fees, the program will cover those expenses. And then any prize money, any scholarships that the students win, they can keep that themselves. And so we encourage the case study competitions. It's a couple of reasons. Is one is it gives an opportunity for students to be able to have an integrative learning experience. They get a chance to network with colleagues or students at other graduate programs. Of course, they can win prizes if they win show place. Some places have scholarship opportunities for up to 5 levels. But also provides a basis for networking that the judges of these case study competitions are often healthcare executives that will serve as future supervisors, perhaps the people that are selecting administrative fellowships. And then finally, of course, we're interested in how our students do, and they perform well. That it gives us feedback on our curriculum and how our students perform based on the training and education that they receive within the program. As a CAHME accredited program, there are hundreds of administrative fellowships available for students that graduate from our program. An administrative fellowship is a postgraduate developmental opportunity, usually 12 to 24 months at a hospital or health system. It could be a part of a federal state government fellowship. But this fellowship, a graduate is a full-time employee with benefits and an appropriate salary for an administrative fellow. And so for this 12 to 24 months, a fellow rounds through the hospital or the system or the health organization. They complete a series of projects. And generally, the fellowship is intended to provide both development and evaluation for a position or a placement following the fellowship within the sponsoring health system or health organization. And so as a CAHME accredited program, our students are eligible to apply for these postgraduate administrative fellowship. Extended note about administrative fellowships is that those individuals that are selected for fellowships, it's an honor. It's noted throughout your career. You will be considered having completed an administrative fellowship at fill in the blank hospital or health system. But those individuals tend to have a higher ascension rate in terms of being selected for higher levels of roles of responsibility, and particularly if they're seeking to work at executive levels. Clearly, all graduates of quality programs have opportunities for that advancement, but the administrative fellowship provides a unique developmental opportunity that students that of our program that have been selected for these fellowships have done really well. So our faculty are doctorally educated. Many of them are healthcare executives. being board certified or serving in leaders within healthcare organizations. We also have 2 executive in residence, former health system executive with Kentucky One Health and University Hospital, and then the former chief medical officer of one of the health organizations here in the Louisville area. We are CAHME accredited. We're also members of the Association of University Programs of Health Administration. It's an organization dedicated to healthcare management education, but also provides scholarship opportunities and development for faculty. Our program is based on 8-week enrollment terms. There's the fall 1, fall 2, spring 1, spring 2, and then a summer 8-week. The 8 weeks are intended from a pedagogy perspective to provide a working professional a focused period of time to complete coursework and then transition to the next course rather than the traditional full fall or full spring or of course the whole summer. It provides a modularity effect, and we see that students are very successfully able to complete their coursework within the 8 weeks. The 8 weeks is condensed, so we have taken courses that perhaps historically have been taught in a full fall or spring, and instead of taking, say, for instance, 4 or 5 of those courses in a full-time basis, a student might only take 1 or 2 courses. And so the choices that students have for a period of time for enrollments is that a student can enroll in 0, 1, 2, or 3 courses. And so when I say 0, it could be that a student might take 1 or 2 courses in fall 1, but if they see that their schedule does not permit, for instance, a military service member that's going to be on deployment, or if you're expecting a child, or if you have an accreditation or a joint commission coming to your organization, and you might choose to not take a class in an 8-week term, that's perfectly fine. You pick right up and complete your enrollments, the next enrollments at the next enrollment period. I might also add program highlights that our program, our MSHA program at University of Louisville has a special MSHA tuition rate of $520 for credit hour, which is lower than the standard tuition rate for online education at the University of Louisville. And for those students that are military service members, there's a $250 per credit hour rate. All right, those are the key highlights. I can always go on more, but want to be sure that to focus on those key aspects. I'm going to close the session and open it up to any questions, but we have a QR code here that if you want to send an inquiry and gain additional information, my contact information, lee.bewley@louisville.edu, is right there. I'm always happy to answer questions or find answers if I don't know directly as it relates to some aspect of admissions or placement, or talk about careers in health administration. Our Director of Student Recruitment is Deepti Jain, and our admissions counselor is Jennifer McLean. A couple of data points. July 1st is the deadline for fall matriculation, so you have time we're sitting here in the end of October. Any student or any prospective student that has a working application in by July 1st, we will review. So a few points about admissions. We're looking for official transcripts, a statement of purpose, a one or 2 page memorandum, basically outlining how a Master's in Science Health Administration program fits into your life career development. We have 3 letters of recommendation. We do not require a GRE or GMAT. The targeted GPA is 3.0 or higher. If a student has a GPA between 2.5 and 2.99, they can be admitted on a conditional basis. The conditional is that the first 9 hours of enrollments in our program the student must earn at least a 3.0 GPA. 3.0 is required for graduation at University of Louisville in a master's degree program. And so a student admitted on a conditional basis, earning a 3.0 or higher in their first enrollment of 9 hours, fully admitted into the program with no issues. We also require a resume, one part just to see how this program fits into your life and your career goals. We're also looking for how much organizational experience you have. Currently, our online MSHA requires up to 5 years of organizational experience. That organizational experience is waiverable, and we're also examining a pathway that for students that have no healthcare experience would be able to enroll in the program but complete a practicum experience. But currently, for those students that are admitted to online program with 5 years or more organizational experience, a practicum is not required. We want to make sure that anyone who is interested in our MSHA program, that there is a way for them, and of course the appropriate development within the program is applied. So those folks that have no healthcare experience, they have an opportunity as we look to the future curriculum to complete a practicum, usually within their employer, within the healthcare field. For folks that come with experience, no practicum is required. So that's a bit of background about our admissions process. If you have any questions, don't hesitate to contact myself or my colleagues. I am going to close out this formal presentation, and I stand for any questions that folks may have. All right. Oh, I see a hand up. Martha?
Yeah, good afternoon, sir. It's Matthew Henson. I'm the one with my hand up.
Matthew. Oh, I'm sorry. I'm trying to see. How can I help? Welcome.
So you were talking about the practicum, and I guess that's my big concern. I'm active duty military. I've worked with at 2 different hospitals as a clinical engineer and as the chief of logistics.
Matthew, you're right on track. If you have at least 5 years of active duty service, you meet all of the admissions requirements. There's no need for required practicum.
Okay, I was a little concerned when you brought that up, because I've seen schools say, well, you don't quite meet requirements, and others say, absolutely, you meet it. I just wanted to see where I would fit with you guys.
I will unabashedly and directly say that you do not need a practicing experience. Our program is transitioning. That historically we had an on-campus program, and students that were often coming directly out of the undergraduate program to our MSHA, they always had a required practicum, and usually they would work as an intern within one of the health organizations in the Louisville area. But now we're focusing on our online program, and so for students that want to attend the University of Louisville but perhaps don't have any healthcare experience, we want to give them an opportunity to attend the program. And so a way to do that is to offer them a practicum experience so that they can have the experience. You are perfectly fine. Anyone that has up to 5 years or more of experience, there's no practicum required. In fact, practically speaking, as you're in the courses, you're going to be given opportunities to have to apply what you're doing now, or from a leadership or management perspective, or things that you observe in your own health organization as part of your deliverables, and you can integrate that knowledge that you're developing within the program based on your working experience. For those students that perhaps are brand new to healthcare, that practicum experience will serve them. But strictly speaking, for admissions process, if you have organizational experience, and specifically organizational experience in healthcare, there will be no practicum required. It's 43 direct credit hours.
Thank you for answering that, sir.
You're welcome, sir. Do you have any additional questions?
The other thing that I was looking at is my bachelor's degree is an unrelated career field, or at least I would call it an unrelated career field. I would have to wait for you guys to look at everything and start the interpretation and reading.
Matthew, you're fine. That's part of if you can have an English degree, a health administration, economics, you could be pre-med. What we're looking for is do you have a bachelor's degree? Are you working, or do you have a clear interest in the ability to apply this master's degree in health administration in the healthcare field? And so it's fine. Let me also say, in terms of our curriculum, we don't assume that a student will have had accounting or finance or statistics. Our courses start off at a basic level and then build up quickly from there. So we don't jump to the immediate conclusion that, well, someone knows what correlation is, or that they know how to calculate, asset plus liabilities equal capital, or we do not. We start off at a base level and then build up quickly over the course of the curriculum. So as long as the bachelor's degree is from an accredited institution, again, the target GPA is 3.0 or higher. If a student has a GPA of 2.5 to 2.99, they can still be admitted on a conditional basis. And the condition is that they do well in the first 9 hours of enrollment, which is a 3.0 or higher. I mean, even GPA, if a person earned a GPA of 2.0 to 2.49, and they graduated from an accredited institution, they can still apply for exceptional admission to the University of Louisville, and that's on a case-by-case basis with the dean of the graduate school and the associate provost.
Okay. Yeah, because everything I've got is based, it's technology management. I got it from WKU, and I've already talked to your counselors, and they said, oh, you guys do a lot of business and a lot of stuff with them all the time.
My wife, Stacy, is a Hilltopper, and I've got a lot of family and friends that are, my brother is also a Hilltopper, so we're happy to have WKU, U of L alums, well, at any point, but I think you should be right on track, sir. And in good company. There are a number of there's topper cards and wild cards, folks that go to UK or Western or Murray or Moorhead, that they come for undergrad, come to U of L for their master's degree.
Okay, that's awesome. I do thank you again for your time, sir.
No problem. And again, if you have any follow-up questions, don't hesitate to send me an email or call. This might well.
Absolutely. Right. I took pictures of the slide deck. I look forward to working with you guys and getting my master's.
Outstanding. I'm looking forward to it. And we'll have an admissions interview. I should probably extend that point. And the admissions interview is all about fit. The fit is if you have the GPA, you have the letters of recommendation. We just want to make sure that what the applicant is looking for in their life and career development, fits the program. The worst thing that we could have is to admit someone to the program and then they spend the first semester like, oh my goodness, health administration, it's not for me. If you have a clear view of how this degree fits in your life and career, and you have the GPA and the letters of recommendation, there is a spot for you at the University of Louisville, and we're happy to have you join the Cardinal family. All right. Well, folks, are there any additional questions with the time we have? All right, hearing none, I'll again say once again, if there's any questions that I can answer, provide any help or assistance, either about our program or the healthcare management career field, please don't hesitate to contact me. I appreciate your interest in our program, and I look forward to spending some more time with all those folks that are looking to take the next steps to join the MSHA Cardinal family. Good night. Have a great holiday weekend coming up.
All right, you have a good night, sir, and thank you again.
You're welcome.